Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello, welcome back to Dentistry's Growing with Grace. I am very excited to have my dear friend, Laurie Owens, here with me today. Laurie, thank you so much for joining me.
Oh, thank you so much for having me. I have been so excited for this morning.
Awesome. So can you tell our audience a little bit about you and what you do in dentistry?
Absolutely. So I am the Director of Medical Billing Education with Devdent, and Devdent stands for Developing Dentistry, which is what our company is truly about, to be a help in medical billing for dentistry as well as sleep education and medical billing. And so we want to help educate dental offices on what the possibilities are, not the probabilities, because with every insurance policy, it can be different. But believe it or not, like Blue Cross of Illinois, if I told you how much money we could get from Blue Cross of Illinois, you would probably fall down.
That's my insurance.
I can tell you what I can get. I know them I think I've bugged them enough that they actually give me a separate phone number and fax number to call because I've worked so much with them. And I think they really see caller ID and go, oh, great, it's Laurie again. But, I think that is a good thing because we have to realize that our dentists are really oral physicians. They're not taking care of teeth, they're taking care of structure, they're taking care of patients' health. And when you can get the oral cavity clean, it can actually help the whole body be able to feel better.
Absolutely.
And so we just need to think about it differently. And when we can think about it differently, it really starts to flow and make better sense.
Mm-hmm.
So that's what we do.
There's some dentists right now going, oh, medical billing, I don't even want to deal with that. I don't want to hear about it. It's too much. I barely have the team right now to function at where I need to function right now. Let's talk about, before we dig into the specifics, because we are going to give them specific takeaways that they can use right away. Before we dig into that, let's first talk about why is it important that our dentists and our friends and our following really understand and embrace medical billing in their profession? What's in it for them?
Well, number one, the dental claim form itself has medical diagnosis coding. So if you think you're going to get away with not learning this, you are sadly mistaken. The only difference is it has not been enforced as of yet. Now, of course, with COVID, I don't think they're going to enforce it next year, but wouldn't it be nice to do something different? And I always tell offices, I'm asking you to look for the things that are not covered by dental insurance, like bone grafting, like cone beams. Start with the small stuff, the stuff that it's not going to get covered by dental insurance, so you're not going to have any loss of waiting for this claim to process. But those are the things that I would say to start with, the low-hanging fruit that is not going to get paid by dentistry. Mm-hmm. So you have nothing to lose. The worst thing they can say is no.
So this is scary for a lot of dentists.
Yes.
Why is that? Do they think that if they start medical billing that they're going to be open to all new problems and liabilities? Talk to me about that.
They really do. I mean, I've been audited by medical, and it was my own fault because they said, we want the money back. And I said, no. And they said, if you don't send the money back, we're going to audit you. I said, I don't care. And so they audited me and I had 0 corrections. I had 0 fines and 0 repayment. And actually they actually sent a letter saying, you are right, this money was warranted. And that's the goal, is making sure your notes reflect your codes. So again, it's not about branching out into something unknown that you're not doing. It's about documenting it so that you can say, this is a medically necessary procedure for this type 2 diabetic that has difficulty with saliva. And most people don't realize diabetes has thicker saliva. So that means the bacteria cannot move through the oral cavity. So right then and there, all diabetics in our practice was billed to medical because There's a correlation. Do you know there's only one diagnosis code for that? Type 2 diabetes with perio, type 2 diabetes with oral complications.
Wow.
So that's
So
how.
it doesn't have to be super complicated. You can go in and identify a subset of patients and learn how to file certain claims, how to document. I'm sure documentation is a big piece of it. And from then on out, they can use this information.
Yes. And so, I mean, it's not, I think medical billing is actually more simplistic than dental billing. Because if you think of it this way, when you do a crown lengthening procedure, the 4249, you send that off to dental. You have to send pre-op x-rays, pre-op photos, post-op x-rays, post-op photos, full arch x-rays, perio charting, chart notes, and everything. And then they still want your firstborn child and your blood type. I mean, that's how it feels. And then on the medical side, all they want is your claim. They want nothing else. No x-rays, no perio
So
charts.
because you don't take photos of diabetes.
Well, no, you don't, because you're telling them.
You take photos of, but you would take photos of like decay. So there's like photographic evidence.
But they don't know how to read it. It doesn't make any sense.
Right.
And you can tell the story in code. And like you and I spoke earlier, decay, we're talking, they want to know surface. Is it pit and fissure? Is it smooth? Is it going to the dentin, to the pulp, or the enamel? That specific code is going to tell them exactly where you were working. And then your chart note would reflect the same. And as long as they can be the same, your chart note says the smooth surface limited to the enamel, and your code reflects smooth surface limited to the enamel. That's what they're looking for, the consistency and the accuracy. And so if we can do that, which I believe a lot of our providers do, we are only sending a claim. We are not having to bulk it with all that documentation, because that's what dentistry needs, not what medical needs.
So if someone's listening right now and is like, you know what, it's been too long that we haven't done this. Where do we start? How do we learn how to do this?
Perfect. So we created a software for dentistry to bill medical. So my first suggestion is do a demo, because you never know you don't know if it's something you like. I can tell you that you're going to put your dental code in, and we're going to tell you what it crosses to in medical so that you can choose appropriately for this particular patient. So say, for instance, you're removing the foreign body from off of the tooth surface. You're going to put your D code in, and we're going to tell you it's this code. And this is what you need, is what surface is it going to be on? So we're going to guide you for that diagnosis primary code. So say, for instance, if you have a patient that has diabetes, like we talked about, type 1 or type 2, you could also say they have a family history. So noting family history is important for medical, because that can tend to why things are starting. So the oral cavity is starting to break down because they have a direct family history of diabetes. So there is, believe it or not, there's a code. Oh, you're going to love this, Grace. There's a code for problems with in-laws. So I've used this code because we had a bruxing patient who came in, and she's like, every morning I feel like my whole jaw is going to fall off. And we asked questions. When did you notice this starting? And she's like, about 3 weeks ago. And I said, what's changed in your family dynamic? Did you change your job? Her in-laws moved into her house. So we did sleep paroxysm with problems with in-laws. So it told the story. Does that make sense? Absolutely.
Oh my goodness.
Again, we have to ask the questions, and with that comes a code. There's also a code for being struck by lightning twice while on skis, but I don't think that's really realistic. But if one person in the entire world had this happen, they created a code for it.
Wow.
We had a patient at our practice that fell off the toilet and hit his mouth on the tub.
Oh.
There's a code for fall off toilet with strike against another object. So there's a code for almost everything. There's so many things in dentistry that's truly trauma like a baby headbutting you when they flip their head backwards.
Oh,
There's a,
I've had that happen.
but that's trauma. That's not dental. And so we have to get back to helping our patients in reality, because what does it do? It, number one, yes, they might have a deductible, but what if you could meet their deductible? What if you were able to satisfy that deductible so that all the other stuff that they had going on could be covered at a higher level?
I do want to say consumers are evolving and becoming more savvy in this area. I have heard recently someone calling, actually it was at a family party recently, as a family member saying, I called and asked them if there was any way that they could also leverage my medical insurance. And they said there's nothing they could do with that. And so I think you're going to hear more and more patients asking, well, this is related to that, or how is this not medical? Because it is. Your oral health care is related to your medical care.
So when I started in dentistry, my first CE course was on bacteremia. And I sat with our hygienist, Elizabeth, and I said, Elizabeth, if we're making people sick, how could this be considered dental? And she said, that's a good question. I don't know. And so that really started me on a journey of trying to figure this out, because in my head, I could not understand how we at the practice made people sick, and yet we were billing only dental insurance. It didn't make sense. We get, at Devdent, we get tons of scaling and root planing covered by medical. Why? Well, what do you think is under the gum line? Is it supposed to be there? It is considered removal of a foreign body. So under the gum line is soft tissue. On the tooth, it's hard tissue. So if you think about it, does it make sense? Absolutely. It is prepared. If you saw my desk right now, you'd see code books everywhere. I have them on a lazy Susan to my right now. And the reason is because I want to make sure that, number one, I'm doing things the right way. That's becoming a professional biller. Those are not credentials anybody needs to have. But when I decided this was my thing, I wanted to make sure I was doing it the right way. So like Roy and I collaborate on the dental side because he knows more about that than I do. Well, I do dental billing also, but I want to make sure that I'm not overstepping.
I just want to say, I love that dental is so small that you can just say Roy, like Grace, your friend Roy. And I know you're talking about Dr. Shelburne, yes. And so many people that are listening may not know Dr. Shelburne. So yes, and it's fun that we as experts and dental advisors, that we all get to know each other a little bit and support each other.
Right. And, you know, we have to know where we are. And this is going from a practice to any kind of educator or consultant, is I don't know everything. And so that's why I believe coaches and people helping your practice move to the next level in marketing. And I just don't think you can know everything. And for somebody to say, well, I know how to do all that, I think is foolish. Yeah. Because you need outside eyes on the practice to give you that perspective to say, you know, you tried this, you've been trying this and it hasn't worked. So let's try this.
Yeah, and people need to stay within their area of expertise, in my opinion, especially when it comes to coding and billing, because there's so much on the line. And I see in these Facebook groups all the time, people saying, you know, what can I do for this? Can I do for that? You get 3 different answers, and you're better off knowing who are my expert advisors that I can turn to, that I pay, that I know I'm going to get the right answers from regarding whatever topic, whether it's medical billing or marketing. Know who to go to for what. So my next question.
Everybody would do that.
Yes. That's part of this podcast video cast is helping people connect to different experts in dentistry so that they can get the right information. So we talked about deductibles a little bit. Is there anything else you want to mention about that?
I want to mention in dentistry, we feel bad. We feel bad because we have to pay. We feel bad because we had to charge them for this, and we feel bad. But think of it this way. Did you choose their deductible? Is it your health plan? should you feel bad because you can't get a payment for them because they have a higher deductible? It's not your plan. You have to be confident in that. It's okay to offer them the service without them expecting any kind of benefit monetarily. Now, if you filed a medical claim that went to their deductible, have you helped your patient? Yes. You might not
You
have
did
done
everything that you could.
right. And remember, whose deductible is it? And I have told patients, I have, so we have a big group out here that has Blue Cross of Illinois, and I know all three of their plans. I know which ones cover implants and bone and things like that, and which one doesn't. So he had the one that doesn't. He needed an all-on-4 maxillary. Well, I told him, I said, look, I don't know how this plays out with with who you see for medical. I don't know how it plays out with what you get prescription wise, but I can tell you if you switch to this plan, it will cover the work you need in your mouth.
Wow.
And he literally changed. He had his service done on January 4th. They paid just fine, just like I had told him they would. And then the next year he switched back. So again, I am not going to tell them that this is what's best for you. I'm going to tell them this is what I know. This plan does cover these particular things that you need to have done, but I don't know how it's going to come into play with your finances, with the doctor you see, or the medications you take. That's what you have to do.
Mm-hmm.
We have got to let our patients own their own health. And like what people say all the time, well, that's going to take up all my time to do this. Why? I make the patient get the letter of recommendation to the practice. I have the patient have their medical doctor do a correlation, if I don't know it, from what's going on to their mouth.
Yeah. And you can, and this is where I always find a way to bring marketing into it because it's where my head is all the time. But you can take these processes and you can package them up for patients. You can give them your information as to this is how we're going to go above and beyond to help you. We're going to help you understand your benefits and help utilize. And how many practices are out there saying we're going to maximize your benefits, but they really aren't because they haven't tapped into medical billing at all.
Absolutely.
So
and I can tell you that, marketing is huge right now. And I always have my practice as number one, they better plan for growth. Before they have Grace come and do their marketing, they better plan for growth because it will skyrocket. And once you get it down, you better plan, how can I put it, where can I put a new employee? Where can I get a new assistant? Because if you start marketing it before you've planned for growth, you've just shot yourself in the foot. You're going to be so busy and crazy, you're probably going to get mad at me. And so that's when I prepare offices. Okay, here's where we can put a new person. Here's where you can do, and not that we're doing it right now, but have that plan so that when Grace comes in and markets for you and gets all this stuff together for a campaign, you know how to grow your team.
yeah,
It's not a question. And that's when you have to realize, I had one patient who called, just like you were saying before, called on the phone and asked if we could bill as medical. And of course, we bill anything. We don't promise dollars, but we bill anything.
yeah.
He came in, we did his treatment. We got about $12,000 for him. He took stacks of our cards and handed them out at work, and we got 12 patients from that one guy. 12.
There's marketing in everything that you do. And the way you serve your patient is the number one way to market. Absolutely. And if you are fully serving them at the highest level, then I believe you would be implementing these kind of things. So I'm going to go off track. I have one more question for you, Laurie. What are some procedures in dentistry that are commonly covered for different reasons? We don't have to go into all the reasons, but are covered sometimes by medical. So give me a few of those.
What about dental caries? So dental caries caused by, I have 23 pages of medications that cause xerostomach conditions in the oral cavity. 23 pages. And it's not one column, it's 3 columns on a page of medications, not only prescription, but over the counter, that causes xerostomach condition in the oral cavity. And so what I'm asking, I mean, you think about this, there's over-the-counter acid reflux meds. Patient might not have GERD, but they're taking Tagamet or Zantac, or those are all xerostomach medications. So
I take Benadryl a lot.
Benadryl is too. So think about what Benadryl does. It
Dries
Benadryl,
you up. Yep.
it dries out the oral cavity too. And so I'm just saying, I am xerostomach. I have a pH of 5, which is highly acidic, but I know what I have and I am prepared. I have spray in my purse and I have this and I have that. But how many of our patients don't understand what's going on in their oral cavity? And you saw them 6 months ago, and now they're in your chair for a routine hygiene visit and they have 6 areas of caries.
Okay, so caries, potentially, it sounds like just about everything.
Everything. So think about it this way. I'm even going to veneers. I helped an office build veneers because of GERD, or I'm sorry, not GERD, tetracycline. So the patient was tetracycline. They did veneers on interiors of upper and lower. Medical paid $7,000 an arch. So think about it.
That's a big deal.
Yeah, we have to think outside the box.
Oh
It
my
is not
goodness.
the procedure you're doing, it's why it needs to be done. What is the why?
Okay, so I just want to put this out there to my friends and clients and audience. If you haven't brought this into your practice, it's the best. If you are saying we serve our patients at the highest value, I'm giving you this advice, not as a dental advisor, but as a patient. Bring this into your practice. I am confident that the investment that you make with Devdent is going to be recouped many, 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 many times. And your patients are going to be ecstatic that you go above and beyond. So in your marketing, when you say you go above and beyond, when you say that you care, when you say that you do everything to serve your patients, this is part of that. So get on it. So Laurie, for someone who's interested in learning more about Devdent and bringing the medical billing into their practice, how do they go about getting in touch?
So we've got so many ways. So if you go to devdent.com, there's lots of free on-demand webinars that they can watch to kind of get your feet wet, just to kind of say, okay, I just need to know more. I need to be more confident in what I'm thinking. And would this apply to our office? Which I know it does, but you have to learn that for yourself. One thing I want to make sure to tell you, I don't just talk about it. I have 5 dental offices I bill for myself. So wow. I don't just talk about it, I do it. And that's on purpose, because I don't want you to think, oh, she did it 5 years ago and she's just telling you what she did 5 years ago. No, I have 5 offices that I'm personally responsible for. My one office here in Washington, we just got 100% payment on Caries, $2,300 from Aetna. So, I mean, that was literally just yesterday morning. And I think it's important. So
it's a game changer.
We have online. So if you say, well, I can't go to a course, which we do, to me, live courses are the best, because I can see your face. I can know if you get it, and we can work one-on-one together. But if you can't go to a live course, we recorded sessions of the whole 2-day course, so you can watch them in sections at your leisure. So
and the software, I think the software is what people can lean on a day-to-day basis as well. So that's incredibly important. So it's Devdent. Is it devdent.com? Okay, so go to Devdent. For any of you who are listening, it's D as in dog, EV, dev, dent.com. And thank you, Laurie, so much for sharing this excellent information.
It's just so exciting, as you can tell. I really get excited about it because I love being able to help. I don't ever get to see the patients of the people that I bill for, but I'm excited for them because
this makes a difference.
My North Carolina office, we got 13 crowns pre-authorized and 2 quads of scaling for a GERD patient.
Wow.
Crowns. That's a lot of crowns.
I know that people think it's just going to be this thing they use here and there, but it's becoming apparent to me that it's something that once you implement this, it's a part of your day-to-day practice. So thank you so much. And for those of you who listen and follow, again, I'm Grace Rizza. Thank you for joining and following our podcast. Our Facebook group is called Dentistry's Growing with Grace. Join us for more information on how to develop and grow your practice and your team. And if you need any help with your marketing, you can find me at identitydental.com. And I hope you have a great day. Thanks.
Thank you.